warm welcome here in our studio in Sarakunda. This is Star TV News and I am Maymuniju Fadera. In the headlines tonight, Health Minister Dr. Amadou Samate confirms 5 new COVID-19 cases in the country on Saturday. Ministry of Basic and Secondary Education Permanent Secretary rubbishes the much talked about rumor circulating on social media that his ministry has received or spent a sum of 35 million to media houses. Management Development Institute (MDI) embarks on research as part of the efforts in combating COVID-19. On the international scene, Africans evicted from homes in China. Libyans complain about lack of virus assistance. Coronavirus deaths in the UK exceed 10,000. Well, those were the headlines, and now the news in details. The Health Minister, Dr. Amadou Samate, has confirmed 5 new cases in the country on Saturday in a press briefing with media houses at his office in Banjul, bringing the number of active cases in the Gambia to 6. Omar Job files in this report.
The new confirmation case means the country has now registered 9 cases of coronavirus, including 2 recoveries and 1 death. The active cases are now 6 in the country.
And they were all together. Coming from the country where they were all staying in. And it is important to emphasize that these people are all Gambians. And it is also important to emphasize that most of them are young. 2 of them are 20 years old each. And the other 2 are 28 years old each. So we have 2 people 20 years old, 2 people 28 years old, and the other individual is in his 60s. Why are we emphasizing this? We are emphasizing this to let the young people know that young people are also vulnerable. We've seen in other countries it affecting more of the older people, but that doesn't mean young people are not vulnerable, and we should all be very responsible citizens, even if the young people withstand the disease. But they could infect people, loved ones, people in the communities.
He said 2 of the confirmed cases were discharged from quarantine and later placed under home isolation on account of recent travel from the United Arab Emirates, while the other confirmed case has recently returned from the United Kingdom.
And the other individual is in his 60s. Why are we emphasizing this? We are emphasizing this to let the young people know that young people are also vulnerable. We've seen in other countries it affecting.
Samate disclosed that the 2 local transmitted cases are from the same compound with the 4th case who is currently receiving treatment. The minister further disclosed that all the confirmed 5 cases are all Gambians. 2 of them are 20 years of age, the other 2 are 28 years, and the other one is in his 60s. He emphasized that young people are also vulnerable. Even if they could withstand the disease, they may transfer it to others. He finally appealed to the people to be very vigilant and ensures the full implementation of public gathering abhorrence of social distance.
But we also appeal to the people of this country. This is not a Ministry of Health issue alone. The ministry can do what it can do, but the ministry cannot make you practice social distancing. People of this country must take their own, they must be responsible. They should participate. Otherwise, the government's efforts will not yield the results that we desire. If we say social distancing and people want to do things as they were doing before, and when there is local transmission and people blame the government for that, is it the government that has taken the virus from one person to the other? No. But we say if we know that it is communicable.
The minister urges the compliance of public gathering restrictions, hand washing and social distancing to cope the virus. For Star TV, I am Omar Job.
The permanent secretary of the Ministry of Basic and Secondary Education, Ibrahim Sisao, has rubbished the much talk about rumor circulating on social media that his ministry has received or spent a sum of 35 million to media houses across the country for the broadcast of school lessons amid COVID-19 lockdown. Dada Cham files in this report.
Ibrahim Sisao made it clear that the ongoing school lesson being broadcast over the airwaves is funded by World Bank under Component 2 projects, which support quality education at the Ministry of Basic and Secondary Education. It could be recalled that Ministry of Basic and Secondary Education has initiated a distant learning lesson through all the media houses, TV and radio stations across the country, so as to engage school-going children who are asked to stay at home amid coronavirus lockdown. Meanwhile, the state of emergency declaration has directly affected about 674,300 children across the country in both conventional and madrasa school, ranging from early childhood development schools to senior secondary schools. An estimated 72 hours of instructional time will be lost due to the initial 21 days of school closure, and more hours will continue to be lost due to the extension of the state of public emergency. Mr. Sisao denied rumor of ministry spending $35 million on media houses. He added that all the monies used for the distant learning lesson program so far are from the Ministry of Basic and Secondary Education budget, adding that they don't receive anything yet from the government. PS Sisao indicated that the total amount spent in the media houses across the country for the program is in two components, saying the total amount spent for the program is $3.7 million. According to him, if there is any other payment made to the program, is for the team of the program developers, which is about $859,000, while emphasizing that with or without COVID-19, the ministry has already committed to content development for TV and radio delivery. He outlined that certain activities were meant to be carried under the project during the COVID-19 period, but could not naturally open due to the banning of the public gathering and closure of schools. Therefore, they have to engage the bank to seek for support for such activities to the initiative. PS Sisao mentioned that the initial 21 days has elapsed, but the state of public emergency has been extended as well as school closure until further notice. Consequently, he said the minister, Claudia Cole, has committed that the ministry will extend the distant education during the period of closure. He finally want to thank people for their encouragement, suggestion and positive criticism during this challenging time. Reporting for Star TV News, I am Dada Cham.
The Management Development Institute, MDI, is also on the front line in the fight against the COVID-19. On Friday, this institution briefed the media on issues regarding their ongoing research, which is meant to produce accurate information on the impact of the coronavirus in the country. Modu Baji was there, and he now files in this report.
In discharging her mandate on economic management research, the Management Development Institute is currently taking rapid assessment on food, economic and social security of households and communities in the Gambia. The assessment covers over 1,350 households in the country. The Director of Research and Consultancy, Babukar Fati, said the COVID-19 has both economic and social effects worldwide. The Gambia is not an exception from these effects. Moreover, MDI took it upon themselves to conduct research on the impact of the COVID-19.
So MDI being an important player in capacity development and research in the Gambia, felt that it is within our purview to make a rapid assessment on what is the impact of COVID-19 on households in three thematic areas: economic security, food security, and social security. When you look at the Gambia on basic economic fact, we are a net importer of food. We heavily rely on food from outside. And these restrictions that are happening globally will mean that there is possibility that the traditional way of sourcing food from the world may change. People become much more nationalistic about their food system. Currently, there are indicators of that in the world press. Countries like Vietnam and Kazakhstan, some part of Russia are making restrictions on possible export of food items. So Gambia being a net importer of food items, this is something that we really need to reflect on before we will be caught off guard, just like we were caught off guard by the presence of probably the disease itself. But when you look at also, we heavily depend on remittance, and a good number of Gambian population lives in the diaspora. And if these restrictions continue and they cannot carry on their normal economic activities, the amount of money they will send to the country will significantly be lessened. And this will have serious ramification on our economic prospect, and it will have serious impact on our socio-economic well-being.
Mr. Fati cited on the impact of the COVID-19 on this year's tourism season and other sectors of the economy as challenges of the COVID-19. He added that empirical data is needed to be able to carve out a sustainable solution, triggering them to carry out this research. The research supervisor at the Management Development Institute, Fanambo, reiterated on the importance of this research.
The Institute has ever guided the government in decision making. That's why we've been having trainings, consultancies, and research. And in the wake of this pandemic, we can't sit back and watch, So that's why we as an institution, we organize this exercise that will help the government to make sound decisions, because the government cannot make sound decisions without having the data it needs, because they need guidance. This data we're collecting, or this exercise that we're doing, will not only help the government, but private sectors, everybody in general in the Gambia.
However, the Management Development Institute intends to publish the outcome of their research in the coming weeks. The senior adjutant consultant at the Management Development Institute, Dr. Hamidou Jawara, lamented that working based on evidence will be a good strategy in this period of the global pandemic.
We should all embrace the idea of, evidence-based policy making. Right? So when, government is thinking about doing something, right? I think, all of us should cry for it to be done based on good judgment, right? Based on realistic evidence, because this is what is going to maximize impact, right? I mean, if you act without using reliable evidence, it's always difficult to get the impact that you want to get, right? And that is the effort that we are contributing to, right? And I hope, when this report is finalized, it would give all stakeholders some food for thought with regards to the interventions that they want to do to curb the economic or social, impact of COVID-19 in our society.
The Management Development Institute was established by an Act of Parliament in 1982 with the objective to provide training on consultancy and economic research. Reporting for Star TV, I am Modu Elbaji.
And now the news beyond our borders. City leaders in southern China are denying allegations of racism amid the coronavirus pandemic, insisting foreigners have not been discriminated against. Africans living in Guangzhou say they have been kicked out of their homes and face harassment as healthcare workers step up testing efforts for new imported infections. The African Union, Nigeria and Ghana are calling on the Chinese government to address concerns. Al Jazeera has the rest of the details.
City leaders in southern China are denying allegations of coronavirus racism, insisting that foreigners are not being discriminated against. Africans living in Guangzhou say that they're being kicked out of their homes and face harassment as health workers step up testing for imported infections. The African Union, Nigeria and Ghana are calling on the Chinese government to address concerns. Professor Keith Richberg is the director of the Journalism and Media Studies Centre at the University of Hong Kong. He says there has been discrimination against Africans living in China for some time now.
Ever since Xi Jinping announced that the virus was essentially contained in China and that they could start reopening businesses and reopening factories, the numbers have been going up, but they've been blaming all of those new numbers, those new cases and the new deaths in China on what they call imported cases. meaning that they've contained it in China, but people coming back into the country are bringing it along. It smacks a bit of xenophobia to me, because number one, most of these so-called imported cases are Chinese nationals who left at Chinese New Year and are just now returning, or returning from schools abroad, etc. So these aren't foreigners; these are Chinese who are bringing in with the virus. And secondly, they've been given really no statistics to prove that the real numbers of people coming in with the virus are actually foreigners at all. But that's kind of the narrative or the storyline that they'd like to say, is that all of these new cases are all from foreigners. They've even restricted foreign diplomats from coming back into Beijing, for example. China has always had this kind of complex relationship with Africa, whereas officially, they see the African countries as brothers. Lately, China has put a lot of development money into Africa. They built the African Union headquarters. They built the railroad from Nairobi to Mombasa. But and as a consequence of these tens of thousands or millions of Chinese living in Africa, you also have a lot of African traders, African students who have gone over to China. And so officially, on an official level, there's this kind of feeling of fraternity. On the ground level, people to people, the Chinese simply don't like them very much. They're basically there's a lot of racism. I've been to Guangzhou. I've been to that area that they call Little Africa, or more derogatorily, they call it the Chocolate City. The Africans tell me they feel discriminated against by the Chinese.
Libya is waging two battles, the civil war, which has split the country, and the fight against the coronavirus. But some communities are complaining about the lack of help from the internationally recognized government to contain the virus. They are forced to rely on donations, volunteers, or any other help they can get. Al Jazeera's Libya correspondent Mahmoud Abdelwahid reports.
This is what lockdown looks like in Tripoli. The government has put a curfew in place. Restaurants and cafes are closed down, education suspended, social gatherings banned, and movement between cities restricted. But the number of COVID-19 is creeping upwards. Authorities say they're doing what they can to prevent further infections, but some municipalities are critical of the government's measures to prevent a bigger outbreak.
We've not received any support from the government as of today. A budget has been dispersed by the central bank, but some municipalities received double their portions, while others received nothing at all.
Communities are trying to fill the gaps where they say the government has failed. This hospital in the city of Misrata has been donated by a local businessman to treat coronavirus patients. And students in the city are using 3D printers to produce safety gear for medical workers. In Tripoli, these young volunteers are relying on donations to conduct sanitization campaign. They're cleaning a home for elderly as well as markets, banks and hospitals.
We do it out of our humanitarian values. We have also launched campaigns to raise people's awareness, especially in slums and areas where there are foreign wages.
The isolation of this house for elderly people, which has natural ventilation, makes it less exposed to infection, and the vulnerability of the people living here makes them a priority in the sanitation campaign run by the volunteers. But schools that have been turned into makeshift camps for those displaced by the war create a bigger risk of infection. The government is attributing the lack of financial support to the oil blockade by forces loyal to the warlord Khalifa Haftar. So in communities across the west of Libya, volunteers are doing what they can to protect themselves and others from the virus. Mahmoud Abdelwahid, Al Jazeera, Tripoli.
In the United Kingdom, the number of reported deaths caused by the coronavirus has soared above 10,000. Prime Minister Boris Johnson is now recuperating at home after spending 3 nights in intensive care. He thanked healthcare workers profusely, but they say they are still short of crucial protective equipment across Europe. Streets were empty over the Easter weekend due to the pandemic. Al Jazeera's Emma Highward reports.
Britain's Prime Minister Boris Johnson left hospital to continue his recovery at his country residence. He was discharged after a week, 3 nights of which he'd spent in intensive care.
I've today left hospital after a week in which the NHS has saved my life, no question. It's hard to find words to express my debt.
He's completely overwhelmed, so it means that some corpses stay 3-4 days in the bedroom, on the bedroom floor.
This weekend should have been one of coming together for many families and friends to mark Easter. Instead, many of Europe's capitals are empty, their landmarks deserted, the churches closed. The Pope delivered his Easter Mass in a much scaled-down service at the Vatican. 100,000 people usually gather in St. Peter's Square to listen. Italy remains the epicentre of Europe's coronavirus outbreak. Other places, though, are feeling the full force of this human disaster. Emma Hayward, Al Jazeera.
And before we end the news, a recap of our main headlines. Health Minister Dr. Amadou Samate confirms 5 new COVID-19 cases in the country on Saturday. Ministry of Basic and Secondary Education Permanent Secretary rubbishes the much talked about rumor circulating on social media that his ministry has received or spent a sum of $35 million to media houses. Management Development Institute MDI embarks on research as part of efforts in combating COVID-19. Africans evicted from homes in China. Libyans complain about lack of virus assistance. Coronavirus deaths in the UK exceed 10,000. Well, that's all for this edition of the news. Please enjoy the rest of our programs and join us tomorrow for more news. Thanks for watching.